Well, good evening, everyone. Thank you very much for joining us. We'll get started shortly. We're doing this going live on Facebook, and we've got to wait for the Facebook folks to join us. So while we're waiting, there's a poll that you should see, and if you could take a second to fill that out, it would be helpful. And while we're waiting for the Facebook people to join, I just want to remind you that if you have a question, go to the Q&A function at the bottom of your screen and you can type it in. And then also, if someone types in a question that you'd like to have answered, you can like that question and will give us an idea how to prioritize the questions that we take. And then I'm going to try and get to every question. If we don't, you can send me your question at thompson.townhall@mail.house.gov. We'll post that for you, and then we'll get an answer for you. It's thompson.townhall@mail.house.gov. Should be live on Facebook in just a moment. So again, type in your questions, take the poll. We'll get started in just a second. All right, we're live on Facebook now. And for those of you who are joining us on Facebook, if you have a question, you can put it in the chat. So again, thank you all for joining us tonight. I'm doing this Zoom for a couple of reasons. One, it's real timely and very, very important, given the fact that the whole issue of the day is the tax credits for the Affordable Care Act. And I'm in Washington. I'd come back in hopes to be able to work on negotiating a close to this government shutdown. Had a hearing here today on the Affordable Care Act tax credits, and that was important to do. I was here. Sadly, my Republican colleagues were not. And I think that's important that we are all here and we're working on stopping the shutdown and making sure people don't lose their health care. Just by way of background, 15 million Americans are going to lose their health care because of the big ugly bill. And now, with the tax credits expiring, premiums are expected to increase by 97%. So in our area, a family of four earning about $130,000 a year will have to pay $14,000 more. A couple 60 years old earning $83,000 a year will pay $24,000 more. Healthcare is already too expensive. This really makes things worse. And I want to specify this is about Americans. It's about Americans losing their health care. It's important to remember that it is illegal to use federal funds to cover health care for undocumented immigrants. So that whole argument about making sure that undocumented immigrants get free health care is just absolute nonsense. We're talking about Americans losing their health care, being priced out of their health care, or spending way too much on health care. So we've got a real treat tonight. We have a special guest, Jessica Altman, who's from Covered California. That's the exchange whereby you can purchase health care in California. And Jessica is the executive director of Covered California. And prior to this, she established and helped grow Pennsylvania's Affordable Care Act marketplace as well. So it's an understatement to say she's an expert. I've met with her a couple of times on this, and she's very, very generously given up her evening to be with us. So Jessica, thank you. And I'm going to turn it over to you, and then we'll do our Q&A.
Wonderful. Well, thank you, Congressman, for having me, but I think more importantly for fighting for the healthcare of your constituents and Americans and for elevating this conversation. I'm really here to speak for the 2 million Californians who rely on Covered California for their health care, and for all Californians who want a healthcare system that will work for them no matter what their circumstances are. Covered California really serves people who are hardworking Californians, but just don't have the privilege of working in a way that they have an employer that is giving them coverage and paying for a large portion of that coverage. So this is about, does everyone in our state and our country deserve access to healthcare? Do people deserve healthcare and the freedom to make economic choices knowing that they have affordable healthcare waiting for them no matter what those choices are? And I think that we will talk through a lot of that today, Congressman, and I'm happy to answer any of your questions or any questions from your constituents tonight.
Well, thank you very much. And I want to ask Melissa, do you have results on the poll?
Still collecting that. If you guys are ready, we can start with questions. There's a bunch of questions in the chat.
Okay. We can do that. But do you have the results of the poll? We're still waiting for that.
Still waiting for the results.
Oh, okay. Sounds good.
The first question says, how will the loss of ACA healthcare, how will the loss of ACA healthcare tax credits impact rural areas like Lake County?
I'll start. First, I'll pick up on where Jessica left off, where she talked about how the exchange provides insurance opportunities for people who aren't covered by their employer. And I think it's important to also note when we were working on the Affordable Care Act, I can't tell you how many people I talked to who said that they felt trapped in their old job because of health care. The only way they could get health care was to work for somebody who provided it. And these were folks who wanted to work on their own, were entrepreneurial, wanted to start a business. So the Affordable Care Act allowed people a place to go to purchase their health care so they could do that. They could become successful business people, entrepreneurs, etc. As far as the specifics of how it's going to hurt people in rural areas, I think it's important to note that 1 in every 4 farmers use the Affordable Care Act for their coverage. And the other issue is if you start pricing people out of the insurance, the healthcare insurance business, and you take 15 million people off of healthcare, that affects all hospitals, healthcare in all areas, but it really hurts rural areas. Rural healthcare was stressed before the big ugly bill passed. We just saw that in Lake County, there was a project proposed and getting ready to get started that would have expanded healthcare. And since this bill passed and was signed into law, that project has been put on hold. So rural counties will suffer more than urban counties will. And Jessica, you want to add to that?
Yeah, I'll just add a few more statistics to the great and accurate ones that you shared, Congressman. So there are about 30,000 people in your district. For those of you listening, right, your friends, your neighbors, if not you, um, you know, half of marketplace enrollees are small business owners, sole proprietors, people who are employed by small businesses that can't offer them health insurance coverage. So think about the person who cuts your hair. Think about the rideshare driver that drove you to the airport. Think about the farmers and farm workers who exactly right 1 in 4. And in your district, Congressman, on average, what people actually pay for coverage, because we're looking at this double whammy. We're looking at tax credits getting lower, or in some cases going away altogether, depending on where your income is. And we're looking at premiums themselves getting higher, both because of the normal reasons with healthcare costs that premiums get higher, but also because with these tax credits expiring, that's going to cause instability that is increasing premiums. So that double whammy in your district is an average increase in what people pay each month of 97%, effectively doubling the cost of what people pay. The other thing I would stress is, I know I've seen some questions from Cover California enrollees, and some questions from people who get their coverage in other ways. This will both impact, um, especially on top of the other cuts to Medicaid, our healthcare system more broadly in ways that are going to impact all of us through higher costs and potentially through impacts on our providers that can hinder access and service delivery, particularly in rural areas. But I also want to stress that with the marketplace, we cover 2 million Californians today, but we've covered 1 in 6 since we opened our doors about a decade ago. And that's because think about what you're doing now, but maybe do you want to start a small business in the future? Might you have to move to part-time because you need to care for an aging parent or a young child? Might you decide you want to retire, but you're not yet 65 and you're 62 and you need a healthcare bridge until your Medicare eligibility kicks in, right? Who needs us today is not necessarily who needs us tomorrow. And we want to be there and we want to be affordable for everyone whenever they need us.
Good, thank you.
Okay, we have some poll results. So the question was, can you afford to pay twice as much for your monthly healthcare premium? We had 90 people who participated in this poll. 9% polled yes, and 91% voted no.
Thank you.
The next question is if
I
rates
think we all knew the answer to that.
next question is if rates spike on exchange, how does that impact people like me who get their healthcare through their work?
Jessica, why don't you take that one?
Yeah, so I talked about this at a high level, but when you think about, the congressman said it, 15 million people losing health insurance coverage when you combine the changes to marketplaces like Cover California and changes to Medicaid, it's about 4 million people here in the state of California. So what does that mean? These people, certainly it's going to impact them at an individual level, but also many of them will still need health care, whether that is going to clinics that offer free services or simply having to end up in the emergency room because they don't have another choice. And our system pays for that, because mostly that is so expensive that the people who end up in the emergency room without insurance can't afford to pay the bill. And providers, particularly our frontline providers who rely on the funding they get through people covered by Medi-Cal, covered by Cover California, they're going to be struggling. And they're either going to be looking to gain revenue by raising their prices on the people that are able to pay them. So coverage from other sources, like if you get coverage from your job and those rates getting higher, and we're already seeing premiums for employer coverage rising more than they have in years at the same time that we're seeing premiums rise otherwise. But also, we've already heard about rural in particular, but also other providers saying, I don't know if I can survive, and not all of them will. We're seeing providers say we have to let go some of our physicians or our nurse practitioners. We're seeing providers say, I'm going to still be here, but I might have to close my maternity services or behavioral health services, things that are tend to not bring in revenue. And these are things that impact access for all of us in our entire communities. And so we really are all invested in a healthcare system that thrives when everybody is a part of it and everybody is covered and everybody can contribute to keeping the healthcare providers that we need and rely on stable and thriving in all of our communities, urban, rural, and in between.
I know in the district that I represent, there are a lot of small businesses who provide coverage through Covered California for their employers or employees.
Yeah, absolutely. Again, half of marketplace enrollees are small business affiliated. 1 in 4 Covered California enrollees are sole proprietors. And one thing that I know and hear a lot from people is, yes, this is about can I afford healthcare, but for a lot of people, it is also can I make this choice? I hear people say all the time, I could only start my small business because I knew I could afford Covered California. And the flip side of that is can you still maintain your small business if the coverage on Covered California is less affordable in the way that we're talking about right now if Congress fails to act on these tax credits. So this is critical for our small businesses, our small business owners who are the engine of our economy and the engine of our communities in so many ways. And we definitely see that at Covered California with the people that we serve.
And you talked a little bit about uncompensated care. So if individuals lose their health care and they become injured or they become ill, they go to the emergency room. And they don't have coverage, they may not be able to pay the full cost or may not be able to pay any of the costs. So the hospitals end up eating this, and that's I guess slang for uncompensated care. But then that's passed on to the rest of us, or it ends up costing the hospital to reduce the services that they provide. Isn't that pretty accurate?
Yeah, that's exactly right.
Okay. The next question says, how much will healthcare costs increase for us if these subsidies are eliminated?
Well, if they're eliminated, if they just increase, as was explained, Jessica said 97% increase. If they were done away with completely, we'd be back where we were before. The whole idea of providing these tax benefits were to get more people insured. The more people that are insured, the less healthcare is going to cost. You bend that proverbial cost curve and get the price down. If people get their health care and it has get it through Covered California, the policy will have preventive health care, so you can get the treatments that you need and the checkups that you need, so you're not waiting until you're acutely ill. When you're acutely ill, it costs a heck of a lot more to take care of you than if you're getting something done because of a preventive healthcare visit. So I don't know. Do you have any idea what the price would be, other than we be back to the times when if you got ill or injured, you were liable to fall into medical bankruptcy and lose everything?
Yeah, and I don't want to get too in the weeds on how the tax credits work on Cover California, but I think it's important to highlight that the enhanced tax credits that we're talking about lapsing here, that built on the original tax credits under the ACA, did two things. They both made tax credits more generous for the lowest income enrollees on Cover California, someone making just above what would otherwise make them eligible for Medi-Cal, maybe $25,000, $30,000 a year in income, and brought tax credits for the first time to middle income enrollees, where there used to be this very harsh cliff for someone making about $65,000 a year or higher, and said instead no one should pay more than 8.5% of their income on their health insurance premium for sort of a core benchmark plan. And so, what that means is what this impact looks like in real dollars is very dependent on your circumstance and where you fall on the income scale. If you're down at that lower end, you're still going to get a tax credit, but it will be less generous. And your payment may say increase from $50 to $100, something like that. But at that middle income level, where you're going to lose, at least under the federal rules, your tax credit altogether, that average increase is $500 a month across the state of California. And we'll see some people, particularly our older enrollees who are at those income levels, who have higher premiums because there's a difference by age, paying really high percentages of their income on their premium. And this is where we know that if Congress lets this happen, right, that people will say, I just can't do it. I just can't afford it. And we will move backwards on some of the progress that we've made to cover Californians, which California, to our great investment and credit, has reduced our uninsured rate more than any state in the nation since the ACA. And that is our mission and our passion, to keep getting more people coverage, and certainly not to move backwards in the way that many of these policies would take us.
Okay. Somebody asked, rate announcements are already being sent out and sign-up season is starting soon. Is there still time for companies to set new rates, or is it too late?
Well, I'm gonna punt to you, Jessica, for the specifics. But I think it's just really important to note that yeah, the rate announcements are already going out. They're they're scheduled to go out. I think this week is when they're started. That's why it's outrageous that the Republicans canceled votes, and there are no Republicans in Washington D.C. That's why we need to speed this up, and we need to negotiate a resolve to this. If not, it's going to have all the negative impacts that we've just talked about. The House of Representatives has not had a House floor vote since September the 19th. And every day that they keep canceling votes is another day further away from resolving this issue. We can't wait any longer for this. And to add insult to injury, if the Republicans would bring their members back and start scheduling regular business in the Capitol while we were putting the final touches on the negotiations, there are other things that we could be doing. For instance, my legislation that allows Medicare folks to have access to telehealth expired. And because the Republicans are on vacation, we have no session, we weren't able to address that. The Farm Bill has expired. We could take up the Farm Bill. Flood insurance has expired. We could take up the flood insurance legislation. So there's plenty of work to do. And we just need to get the speaker to bring his members back and start scheduling the time to do the work. And Jessica, I'll defer to you.
Yeah, just to circle back on the timing, right? We've heard some in Washington saying like, oh, these expire at the end of the year. We have until the end of the year. But for all my Cover California enrollees that are clearly here and wonderful to hear from you at any time, you know that you get your notices in the mail in October. And the shopping window starts in November. And if you want your coverage to start on January 1st, you have to decide by the end of December. And so that timeline is just inconsistent with the actual experience of the real people that rely on this coverage. And if we want to avoid these tensions, these hard choices, this sticker shock, it really has to be done yesterday and certainly right now. Just for to speak directly to the Covered California enrollees, you will soon be receiving your annual notice from us in the mail. That notice recognizes both that the current state is that these enhanced tax credits expire and will show you your costs and options based on that scenario. That notice will also say there could be changes. Congress could still act, and if so, you will hear from us as quickly as possible, right? We can deliver these higher tax credits at any time. I hate to think about the sticker shock and the stress and the pain that people will go through if that happens late in the process. But we can do it and we will. And Cover California can be your source of truth for what is happening, what has changed, and what it means for you. And we are committed to doing everything that we can to communicate as quickly as possible, as honestly and accurately as possible, and to be as supportive as we can for our enrollees who are going to have, we know, very challenging decisions to make about their health, their family, their financial security, and well-being, in these scenarios.
Somebody asked, what percentage of your Republican colleagues do you feel are fed up with Trump?
I don't know that I can answer that with any accuracy, but I can tell you a real surprise to a lot of us was one of our Republican colleagues, Marjorie Taylor Greene, who's a real firebrand, extreme right-wing person from Texas, said, and I'll quote, quote, my own adult children's insurance premiums for 2026 are going to double. I'm absolutely disgusted that health insurance premiums will double if the tax credits expire this year. Not a single Republican in leadership talked to us about this or has given us a plan to help Americans deal with their health insurance premium. Doubling. We have to do something about the absolutely insane cost of insurance for Americans. And that's from Marjorie Taylor Greene, who has always been lockstep with this president and in the right hand lane in her on her side of the aisle. So you're starting to see some cracks. People are finally getting it. They're upset that they're not here working on it. They're upset that this information was kept from them. They had no idea when they voted for the big ugly bill that they were going to experience these types of cuts. And that's exactly why it's important to get the word out. People need to hear it. And if enough of them hear from their constituents, they'll be pushing Speaker Johnson to bring them back and to work with Democrats to resolve this issue.
Someone asked, I heard that Democrats are lying about the Medicare cuts and are shutting down the government to give free health care to illegal immigrants. What's the deal?
They said they're lying about the Medicare cuts or Medicaid?
Medicare cuts.
Okay, well, there's nobody lying about Medicare cuts or Medicaid cuts or anything else. The fact of the matter is that Medicare is potentially going to be cut by about $500 million, and that's because of previous law that deals with cuts and deficits. And there's no misunderstanding that the big ugly bill cut $1 trillion out of health care that funds Medicaid. And so that's factual. I haven't heard anyone dispute that. But I guess the part that I hear most is that this is all being done because we want undocumented immigrants to be able to get free health care. And it's anybody who says that is either telling a lie or repeating a lie that they were heard. They may have been led to believe this is true, but it's not. The law prohibits any federal government money going to pay for health care for anyone who is undocumented. The 30,000 people that the director mentioned that would be harmed and see their premiums doubled in our district are all U.S. citizens, are all Americans. There are no undocumented individuals here. And you want to add to that, Jessica?
Yeah, I mean, just to say it very clearly, since the very beginning, since the Affordable Care Act, the law of this land is that the marketplaces and the tax credits that we provide are not available to those that are not documented or illegal, depending on what wording you want to use. We have never provided coverage to that population. It is not on the table to cover that population through any proposal in Congress. And this isn't just me sort of guessing. Every single person on Covered California, we verify their citizenship or whether they're here with a legal status that makes them eligible for coverage and for tax credits. And the source of truth on that is the U.S. Department of Homeland Security. It is the U.S. Department of Homeland Security that gives us the final word on who can and cannot get coverage through our program. And so those steps are all in place. And to be honest, I've heard that message, and I don't really understand what it's intended to mean as it pertains to the marketplace, because the rules are very clear and we all comply with them.
I don't think Kristi Noem is going to allow any exceptions.
Somebody asked, how do you plan to improve the Democratic messaging about this issue? Republicans are dominating the media with idiotic lies about shutting down the government to give illegal immigrants insurance, even though they do not qualify. How do you plan to shift the messaging to what it is? Republicans have bought a tax cut for the rich by raising the healthcare insurance costs for the poor. Or is that Republicans have forced a shutdown rather than allow American citizens to keep their health insurance?
Well, I think that Democrats, evidenced by the fact that we're in Washington, evidenced by the fact that we held a hearing in Washington that was widely covered, evidenced by the fact that I'm doing this virtual town hall, we're using everything: television, social media, podcasts, town hall meetings. I think it's working. I don't, I know that the Republicans are doing the undocumented immigrant nonsense. And some people are believing it. They would believe anything that they were told, I think, by their party. But I think it's working. You know, look at the fact that Republicans have doubled down on their direction to their members not to hold town hall meetings. Republicans aren't holding any town hall meetings on this shutdown, nor are they holding town hall meetings on the healthcare crisis that they've created. So I know that shutdowns are unpopular with people on both sides of the aisle. I don't like them. I don't like them any more than anyone else. But I don't like the fact that what they're trying to do will decimate the delivery of health care to my constituents and constituents across the country. So I think that the word is out, and I think that that Marjorie Taylor Greene coming out and pointing out how crazy their policy is, I think is another good example that the message is getting out.
If we have healthcare coverage through Covered California for our small business, will we also be affected by these large increases?
Jessica, I'm going to punt to you.
Yeah, so small businesses look to cover California in a few different ways. One is through the Covered California for individuals and families, people who buy coverage for themselves. That's really what we've been talking about today and where these tax credits are widely available. We do also operate something called Covered California for small businesses who want to purchase coverage for themselves and everybody that they employ. And these tax credits that we're talking about do not apply and have never been available in Cover California for small business. So Cover California for small business itself is impacted in the same way as other employer coverage through these broader ripple effects that are going to impact costs and access overall. But if you are a small business, a small employer, a sole proprietor, a small business employee who is buying insurance for yourself, which is very common, then you are impacted in these very direct ways that we're talking about and have talked about throughout the call today. If I didn't answer that question, you're not sure about your circumstance, put another question in the chat. I'm happy to follow up.
I'm a self-employed single individual who receives health insurance through Covered California. Unfortunately, at the age of 58, it has become essential for medication and treatment. My current policy with a tax credit is $234 a month, 50,000 annually earnings. Paperwork received from Anthem BC lists $1,646 a month. With a tax credit, $609 a month. What will we do? Does California have a plan for us?
Jessica?
Yeah. Well, first of all, Elizabeth, I want to thank you for putting a real face to exactly what we're talking about, right? Your costs going from $234 to $600 for the same plan. I wish that were an isolated example, but that is the impact that we're talking about. And it is you that the congressman is fighting for, and it is you that we are at Cover California spending so much time and effort trying to highlight the impact, the stories for real people. And I guess where I would start is that end result is not a foregone conclusion. Congress could still act. Congress has time to act for us to restore the affordability that you've relied on. And I think that is where we absolutely need to start. If we are in this world where they have not been extended and there are hard decisions to make, we're here to support you. You'll get very direct information from us. There may be an opportunity to choose a plan with a lower premium, depending on what plan you're enrolled in now and what's available in your area, and we'll help show you that. But right now, I really feel like there is this opportunity where we have people fighting for the right outcome here, which is to extend the enhanced tax credits and protect affordability for small business owners just like you.
Thank you for sharing your very real and very sobering circumstances.
Somebody asked, how will the price of Medicare be affected?
Well, there's a strong likelihood that because of the funding formulas, there will be a Medicare cut. We're working to avoid that, and hopefully we'll be able to do it. But when you take $1 trillion out of healthcare, as was done for Medicaid, and then you turn around and you cut the ACA tax cut premiums, you're going to affect all of healthcare. It just doesn't work any other way. It's like a balloon. You push one place, it bulges someplace else, and we're going to see that in the cost of and the delivery of healthcare. If facilities have to close, hospitals and clinics and rest homes, that's going to have an impact on the overall cost of healthcare, which will affect everything: private pay, insurance covered healthcare, Medicare, Medicaid. If hospitals and clinics have to reduce their services in order to keep their doors open, same situation. If the cost, if more people rely on the emergency room for their health care, that's going to impact the price, and it's going to impact the workability of the hospital. They can only sustain a certain amount of that. So everything is at risk in the healthcare space.
Yeah, I mean, just to reiterate, hospitals are not Medicare hospitals. Doctors are not Medicare doctors. All of these providers that deliver care are for everyone. And when they're impacted, there will be ways in which we're all impacted. Even if you're not someone like the person whose question we just heard, whose individual premium for them and their family is directly at stake here.
Okay, the next one says, I have family members who are currently on Medi-Cal, but I'm concerned the new reporting requirements will be too burdensome for them because they are gig workers and their income consequentially fluctuates month to month. Though their annual income qualifies them for Medi-Cal, in the past, they have allowed the government to access their annual tax returns to verify their eligibility. But it sounds like this will no longer be enough. Is there anything they should be doing now to prepare for these changes?
Well, Jessica, do you have anything on that?
Yeah, I mean, first of all, I think there are a lot of requirements that are coming that are just more paperwork, more red tape, more ways in which just the process could keep people from being covered who are eligible for these programs based on even the higher and more limited rules that we're seeing coming out of this Congress. So I think we should be concerned, but this is one that we together can solve by being prepared, by educating ourselves, by supporting one another, by state government programs like Cover California and Medi-Cal, sort of really thinking in that consumer-centric way. And while I don't speak for Medi-Cal, we do operate very much in partnership. Our systems are shared and connected. So if you come to Cover California, we're looking at your income and it looks like you're Medi-Cal eligible, we'll get you over there and vice versa. So what I can tell you is there is deep awareness of the possibility of people getting stuck over these work requirements, deep appreciation that there are many workers in California who are Medi-Cal eligible, whose income is complicated and variable and difficult to track, like gig economy workers, and so many, and a lot of thought going into how we can design processes so people can get through them and not get stuck in that paperwork process. What I can tell you right now to do is any document you have online or in the mail that says what your income is and has been, make sure that you're keeping that. Make sure you're filing it in a place that you know exactly where it is. We are years away from the work requirements actually going into effect. So I'm not necessarily saying you need to do that right now, but as we get towards that moment, that's always good practice anyway. But making sure you have that information at your fingertips, that's what you're going to want to do. But know that the public servants, the state of California, we're in this for you, and we're trying to design these processes in a way that mitigates those red tape harms.
And if anybody has a specific individual problem, you can call one of my district offices and we'll help you work through that as well.
Somebody asked, will federal employees get paid when the shutdown is over?
Yes, in 2019, there was a bill, I voted for it, and ironically, the current president signed it into law, and it ensures that federal employees are paid when the shutdown is over. I know there's been a lot of chatter coming out of the White House about how they're not going to pay federal employees and they're going to fire people. Yeah, I can't. I take no responsibility for some of the things that comes out of this White House. But it's not surprising that they would try and be cruel to people and try and scare people. That's what they've been doing. They've fired thousands of federal employees since this guy became the president. They've cut programs across our own district. Cancer research, it's important cancer research and Alzheimer's research and spina bifida research that were taking place at UC Davis in our district. 30% of the people that they fired were veterans. So it's pretty clear that they're trying to do anything that they can to frighten people and get people to comply with their ideologies. But the law is pretty clear. If you're a federal employee, when this thing is over, you get your pay.
Somebody asked, would you support a 2-year ACA extension to reopen the government?
Well, I think there's room to negotiate. I don't know what the period of time is, but there is a negotiated solution to be had. I am not interested in kicking the can down the road for a short period of time so we can come back and go through this exercise again. I think that's pretty crazy. And I think you have to remember that the bill that the Republicans passed, the president signed into law, took $5 trillion and added that to our national debt so they could do a tax cut for the richest people in the country. They cut healthcare by $1 trillion and increased our national debt by $5 trillion just so they could do tax breaks for people who don't need a tax break in this environment. And to think that they're going to now come back and say, don't worry, we're going to hold everybody harmless for a 2-year period, I don't think that cuts it. I think we need to have some guarantee that we get health care relief for Americans who are hard workers, need this help. And I think a short-term negotiated settlement would come back to bite us. We'd be right back here in a very short order.
The clean CR is at Biden era spending levels. Why won't Democrats accept that?
Well, I think it's pretty obvious. For the past 7 months, this administration has taken money from medical research, for food, for school meals, for law enforcement, fire resilience and prevention grants. The spending levels are really pretty meaningless if this administration continues to break the law and steals whatever it wants. We need an agreement that protects against a president who doesn't follow the law.
Somebody asked, why don't Democrats negotiate with Republicans on health care?
Well, as I've said before, I'm in Washington right now. most of my Democratic colleagues are in Washington right now. Our Republican colleagues are on vacation. They haven't taken up a vote in the House since September the 19th. Some say they don't want to bring their members back because if they do, they're going to have to swear in a newly elected member of the House, a Democrat. Once she's sworn in, she becomes the 218th signature on a petition called a discharge petition, which if 218 members of Congress sign it, the Republicans have to take up the bill, and the bill is the one that would require that the Jeffrey Epstein files be released. We're getting more and more pressure from the Republican side that they want to do something. I referenced already the Marjorie Taylor Greene comments that she made. We've got one of my colleagues is a Florida Republican, and they represent almost 300,000 people who are going to be impacted in that one district that are going to be impacted by these tax cuts for the ACA. Our district is 30,000. Her district is 298,000. There are a ton of Republican districts that fall into those high numbers. So they're going to start hearing about it from their constituents, and hopefully that'll be enough where they give the speaker the message that they want to come back in and go to work, leave the vacation behind.
Will systems like Kaiser be affected as well?
Jessica?
Yeah, so I think the way that I think about that question is Kaiser is one of the health plans that offers coverage on Cover California, and they're one of our two largest in terms of enrollment. Kaiser is one of the health plans that provides Medi-Cal coverage to many Californians as well. And so when you're talking about more people going uninsured, you're talking about Kaiser losing enrollees, just like every other health plan in California and the country losing enrollees. What's interesting with Kaiser is because they're also a provider, that means there's less people using their providers, less people using their facilities. And so obviously, Kaiser's individual circumstance, depending on where in the state you are and how many people they have that are directly or indirectly impacted by this, will vary. But I could certainly see a situation where Kaiser is saying, do I need as many of these types of providers as I have today? Do I need to have the same number of facilities in some of these areas where I used to have a lot more enrollees than I have today, right? A lot of those same questions that providers really in any circumstance are going to apply to Kaiser and have impact for Kaiser members across the board.
Can you comment on the dangers to people who have medical coverage from large numbers of people who do not have coverage in terms of contagious diseases and other untreated medical issues, proactive and or reactive? Why is this not front and center in discussions about this issue? Is everyone at a higher risk of illness and the other consequences of untreated illness with large numbers of people with no access to medical care?
The answer is yes. It's the same reason that you don't want your neighbor to have all kinds of fire hazards on their property. If it catches fire, your house is liable to burn down also. It's important that we have a healthy society, that our communities are healthy. And if somebody is ill, they get the health care that they need so they're not contagious. And, contagious diseases don't skip over certain party registration. They affect everybody. They don't skip over neighborhoods. They affect everybody. So it's important that we address that and we have access to quality, affordable health care for people. It's something I've been working on for a long time and will continue to. And this really disrupts that healthcare safety net that's out there, and it makes us all less safe and potentially less healthy.
What is the best way for Californians, a Democratic state, to reach out to Republican congressmen who aren't our representatives to urge them to come back to session?
Well, I think it's important for, if if you've got a mother-in-law, a brother-in-law, a sister-in-law, a cousin, an army buddy, a fraternity buddy, a sorority buddy, a nephew in another area, in a Republican area, you should talk to them. I think it's important that we speak out because what happens in our district, if it's Vacaville, Santa Rosa, Davis, Napa, Lakeport, Rio Vista, wherever it is, that gets picked up in the news. People hear about it. And anything we can do to add our voice to the growing chorus of people who are concerned. Marjorie Taylor Greene is in our camp. And so I just think we need to continue to expand that and do what we can. Again, that's why I'm in Washington today. I was on 4 different podcasts today. I was participated in a hearing, gave remarks about the impact that this is having on specific individuals in our district. That's why I'm having this telephone or this virtual town hall. I'll continue to do that. You continue to do the same thing, and as I say, the chorus gets louder and louder.
Someone asked, are the Dems in Congress able to continue to meet as a body? How are you strategizing? And please do not stop pushing the release of the Epstein files.
Well, I already mentioned the Epstein files, and that's because there's one signature on a discharge petition away from release of the Epstein files, and that's our new member, Congresswoman-elect Grijalva. She was elected in a special election to succeed her father, who was a longtime member of Congress. She has already said she'll sign the discharge petition. And there's a lot of people who think that the reason Mike Johnson refuses to have her sworn in is because he knows she will, and that's going to create problems for him and for the president. So I don't think anybody's going to stop pushing that. And yes, we strategize. It took some doing to set up this policy and steering hearing today, where members spoke, experts spoke, to get the word out and how dangerous this is for people to lose their health care and how unaffordable it is to see a 97% increase in your health care premiums. We continue to do that, and we will continue.
Somebody said, I'm concerned about flying with so many people not showing up to work in flight towers. How long could the government shutdown last?
Well, I think that the FAA furloughed 22% of their workers. I'm flying back from the district I flew back from the district to DC yesterday. There were no problems. I think things are safe right now. As we come up against these deadlines, we've got the TSA deadline coming up, the FAA deadline coming up, the military deadline coming up. I think that's going to add more pressure to the need to get this shutdown solved. And I'm more than ready to solve it, but I'm not willing to give up on the 30,000 people in our district who are going to at best, see their health care premiums double in price.
We have time for one more. Someone said, I am thinking about retiring next year at the age of 70. I don't know if I can afford health care. Is there a place that I can see how much it is going to cost me?
I know a person, Jessica.
Yeah, well, if you're 70, I would hope that you and you were working that you're eligible for Medicare, in which case you may already be enrolled in Medicare or at least have gotten all of your paperwork. But there are people who are over 65 and for whatever reason are not eligible for Medicare. And then Covered California is for you. You can come on Covered California at any time, enter some basic information about yourself, and get a quick quote. What I will say right now is Until right now, October 15th is the day. It's currently showing you prices for 2025. So people that are buying coverage for the rest of this year, and the enhanced tax credits are still in place. Later this month, we'll be having shopping for 2026 costs, which, as we've talked about today, currently will reflect the higher prices that would be the result of the enhanced tax credits going away. And obviously, the ultimate answer on the enhanced tax credits would have a very big impact on price. So I'll just say Cover California, if you're not Medicare eligible, is a place that you can go and shop. But just make sure you're aware of what has or hasn't happened in the world, because that will very much impact the prices you see when you do that.
Jessica, thank you very much for joining us. To everyone who was on the virtual town hall, thank you. I'll be having more town halls, more live ones, and probably a few virtual ones as well. If someone had a question that wasn't answered, remember you can email me your question at thompson.townhall@mail.house.gov, and we'll get an answer for you. So again, thank you all very much. Jessica, thank you for being here. Thanks for the great work you do at Covered California. You help a ton of people get health care coverage. And everybody I know who's ever worked with you have great things to say about you. I think you're doing a great job at Covered California. Much appreciate it. Much appreciate you being here. Thank you all very much, and I'll see you all at home.
Thank you, everyone. Thank you, Congressman.
Thank you.